Good morning and thank you for joining us today. My name is Natalie Alouche and I'll be speaking to you about animal-assisted therapy and how it can help youth at risk. The presentation will include an objective, target populations and settings, program goals, anticipated outcomes, evidence-based research on animal-assisted therapy, and conclusions. What would the mission statement sound like for an animal-assisted therapy group that was working with youth at risk? It may sound something like this: to provide youth the opportunity for self-growth through animal-assisted therapy and humane education by teaching and reinforcing the principles of compassion, empathy, responsibility, self-control, and respecting the rights of others. This is important for everyone in society. It's especially important for children who, through no fault of their own, have to face difficult situations on a daily basis. Youth at risk are those who display or have a history of poor pro-social skills, inability to control themselves and have angry outbursts, poor judgment and decision-making skills, and have socially unacceptable expressions of anger. The setting can be anywhere: social settings, community settings, juvenile justice facilities. But for the sake of this presentation, we will keep the setting to the elementary school. What could be some of the goals for a program that incorporates the use of trained canines to work with children at risk? How about helping youth to improve their behavior, their social skills, and their self-esteem? Teaching knowledge about animals and compassion towards other sentient beings, developing responsibility, overcoming loneliness, providing positive experiences in everyday life, and giving the youth the chance to bond with the animal and to learn about the importance of caring for another. What would be some of the anticipated outcomes that you could think of for an animal-assisted therapy program? How about enhancing pro-social skills and objectivity in young people, giving them the tools to learn positive coping skills in the face of adversity, improving understanding and display of empathetic behavior towards others, towards animals, and improving their adjustment and functioning. Evidence-based research in animal-assisted therapy has shown that it does provide emotional support. In a study by Arco and Kasdan in 2010, both authors proved that while children engage with animals in a therapeutic setting, a non-judgmental acceptance is provided, attention is focused, a sense of safety, normalcy, and friendliness is built, which allows for the building of rapport with the adult professionals and the children. Dogs are usually brought in with their handlers once they've been trained, certified, and registered, and have passed many obedience tests. These are very skilled dogs who come in and spend time with the children in a number of different areas. The dog can sit beside each child as an introduction to say hello at the beginning of a session. There can be curriculum that you can add to your program if you want to make it an inclusive program, or you can bring the dog to help children increase their reading skills. Observations and discussions regarding the canine responses to the human emotions also allow for the transference of feelings and the building of empathy and compassion among the participants. The dog is the bridge and the facilitator in the group. Many valuable lessons can be learned. The first is the ability to empathize. This is the first step in the development of a compassionate character in a child. The dog establishes rapport with the group and with individuals and is seen as a friend. It serves as a confidant for each group member and poses no risk or threat. It promotes giving behavior in a non-judgmental setting. So in summary, animal-assisted therapy is an effective approach for reaching out to youth at risk and for helping them to develop empathy and other key social skills. It can also allow school counselors who are trained in this area for potentially weekly intensive interactions with children that they are following or they are concerned about. The canine is seen as an integral part of the group and soon becomes a friend of the youth involved. As long as we remain realistic and we realize and accept that longer-term treatment may be needed for some children, this is a wonderful way to set up a bridge to healing. Thank you very much for attending my session, and I hope you've enjoyed it.